Many countries are likely to struggle to deal with a major outbreak of a deadly infectious disease. That's the conclusion from researchers who published a new index ranking the readiness of health systems to cope with a pandemic. The Global Health Security Index says 13 of nearly 200 countries are pandemic ready. The index is the first comprehensive assessment of the global ability to deal with epidemic and pandemic threats. Nations ranked most prepared include the United States, the United Kingdom, the Netherlands, Australia and Canada. Here in Asia, Thailand is the highest ranked at number 6 worldwide. Malaysia comes in at number 18, Singapore 24, and Indonesia comes in at 30th. China, the center of the coronavirus outbreak, is down at 51. Researchers say all countries have important gaps to address in terms of their health security. They say all governments must build up their capacities to detect and address biological threats. Shreya Mukarji is a senior analyst at the Economic Unit. She joins us live from New Delhi for more on this. Shreya, how prepared is Asia for a pandemic? Which are the countries that are pandemic ready, if you like?
Sure. So if we look at the scores from the Global Health Security Index and actually divide countries into 3 categories, that is countries that are least prepared, countries that are more prepared, and countries that are the most prepared, the results show that the majority of countries in Asia fall within the more prepared category, which is the middle tier. There is no country in Asia that is fully prepared for an epidemic or a pandemic, as every country still has important gaps to address when we look closely at their national health security systems. There are some areas that are strong in the region when we look particularly at indicators that had pertained to response, which was actually one of the categories that we used for assessment in the index. Some areas that still need improvement, though, are strengthening existing health systems, developing further capacity, and this is, of course, specific to individual countries. But the bottom line here is that global biological risks are growing, and in many cases, this is happening at a rate that is faster than what health systems and security and policy can actually keep up with. And there is a need for countries to therefore invest more in biological preparedness, especially in Asia.
Shreya, Singapore came in at 24, number 24 on this list. Where does it rank in terms of that preparedness, and what are the gaps that it still needs to address?
Indeed. So Singapore is actually one of the relatively stronger performers in the region. It comes in the category of countries that is relatively more prepared again. Particular indicators where it did well in was with regard to response. That is rapid response to and mitigation of the spread of a potential epidemic. In fact, it's noteworthy that Singapore actually ranked 11th out of 195 countries, particularly for that indicator. The country also did well when looking at links between security and public health authorities, which was actually a very difficult indicator to score well in, and where a lot of countries need a lot of work. In terms of areas for improvement, there are aspects, of course, of health services and health capacity, like communication with healthcare workers during a public health emergency, which emerged as potential areas where more work can be done. But overall, however, I would say that Singapore ranks well in the region relative to other countries. But as always, there is always scope to strengthen the existing system.
Well, China is at the epicenter of a current novel coronavirus outbreak. What's China's level of preparedness for this outbreak that we're experiencing?
Indeed. So China, while it also falls under countries that are more prepared, it is, of course, much lower in the rank when you compare it to the other countries in Asia. The country is doing well, of course, in some domains, but there is definitely room for improvement when you consider capacity to deal with a potential outbreak. In fact, according to our research at the time, we found that China did particularly well relative to other indicators when measuring its ability to respond to an outbreak. Risk communication and communications infrastructure were actually 2 areas that stood out. But at the same time, there is massive room for strengthening existing capacities. China actually scored lower in indicators that measured the ability of the country to detect and to report, for instance, and especially when linking public health and security authorities, which is an extremely important component.
Shreya, the world is so much more interconnected now. transportation links are so involved and so on, and making the risk of pandemics ever greater. What was the goal behind this index? Why was it compiled?
Absolutely. As you just summed up, we are living in a world now with an increasing number of biological threats, more frequent outbreaks, whether they occur naturally or accidentally or even deliberately. Over the last 2 decades, in fact, outbreaks have been occurring with greater frequency. We had SARS in 2002, followed by H1N1. We had MERS, Ebola, and the Zika virus, just to name a few. A number of reasons why this has been happening more, because of growth, population growth, demographic change, climate change, to name a few factors. So in this environment, it's clear that global preparedness for a catastrophic biological threat is actually poor, and biosecurity and biosafety remain particular areas that have been under-prioritized when we look at health security. So with this in mind, the GHS index was intended to be a key resource in the face of increasingly high consequences in light of major gaps that exist currently in international preparedness, and essentially to enable countries to really critically assess where they stand and to identify where the potential weak links are.
And there's always room for improvement, as you've sort of alluded to. How can governments, especially here in Asia, boost their level of preparedness?
Definitely. There are a number of things that governments can do. And in fact, the GHS index states that it's not just governments, but it's actually a collective responsibility of key international stakeholders as well. But if we look closely at governments, national governments should first commit to take action to address health security risks. Leaders in countries should closely coordinate and track in-country health security investments, and to make sure that there are routine and public healthcare system updates. Healthcare in every country should be transparent in terms of security capacity, and measurements should take place regularly. In fact, the results of these external evaluations and self-assessments that countries actually do should be published at least once every 2 years. Beyond this, countries should test health security capacities and publish after-action reviews annually. And of course, if we look at financing, it's important for there to be new financing mechanisms to fill epidemic and preparedness gaps. That's urgently needed and should be established.
All right, many thanks for your thoughts this evening. Shreya Mukarji, Senior Analyst at the Economic Unit.